Thank you so much. We are very grateful for this opportunity to be engaged in this important forum. Um, First of all, we would like to congratulate on the EU stakeholders for very important. I think the strategy is excellent, and we are really happy to see that after 1.5 year implementation, you have shown concrete result on the ground. So this is impressive. We are living in a constantly changing, deeply polarized and dangerous world, but the EU has been a consistent and reliable partner in international development in general and in global health in particular. So we are really grateful. Um, I remember that many years ago when I started my career in global health, by the way, working under the leadership of Agnes Suka. So good to see you online, Agnes. Hi. Um, I remember in those days when it comes to EU partners, we they came as individual bilateral agencies, Swedish SIDA, UK DFID, so on and so forth. But increasingly, we see that now you come together at Team Europe, and we think this is an extremely important direction toward multilateralism to enhance your effectiveness and efficiency. So congratulations. Um, Talking about synergy between the World Bank and EU, we thought that perhaps one good way to do that is to recap who we are as the World Bank Group, our priorities, how we do it. I think that's a good entry point to explore synergy and collaboration. The previous speakers have put it beautifully about the current global health landscape and the challenges we are facing today. So I won't go into detail, but I just want to reiterate the fact that globally, um, more than 50% of the population still do not have access to essential health services, and the absolute number is about 4.5 billion. And among those, around 2 billion people are pushed deeper into poverty due to healthcare expenditure out of pocket. And uh, against the background, we have so many mega trends that affect the global health landscape. And Agnes Suka talked a lot about and also Dr. Lisa Maria talked about the current financing landscape. We are at the World Bank because health financing is one of our focus. So we are really worried that the fact that after the pandemic, the increase in health financing actually have dropped to very quickly in 2023. It has dropped back to the 2019 level. And if we look at the share of government spending on health at the share of the government budget, actually the level in countries have dropped even before the pre-pandemic level. So that is a major concern. And of course, pandemic threat is still there. AMR is spreading, the rise of NCD and climate change and aging contribute to the challenges. So against this challenging landscape, the bank has made a commitment to support countries to expand health services to 1.5 billion people by 2030. And we will be, our key approach is how we're going to help countries achieve this ambitious target. We plan to serve more people in more places across more demographic and health needs and especially with a focus on improving financial protection and prevent them from falling into poverty due to our pocket health expenditure. Traditionally, in the past, in our agenda, we have a very strong focus on maternal and child health. But given the new landscape, that's not enough. We need to expand to older age group, given the rise in NCD and aging. So increasingly, in the region that I'm currently working with is Europe and Central Asia, we are doing a lot of work in NCD control, healthy aging, and long-term care. And this is our guiding framework, and as you can see, it has a lot of, I would say, common features with the EU guiding principle for global health strategy. What we want to achieve is basically the World Bank as a group. We focus on ending extreme poverty and boost share prosperity on a livable planet, with a priority focus on jobs as a pathway out of poverty. So, under this overarching objective of the World Bank Group, the health, nutrition, and population global practice, our focus would be delivering on the World Bank mission in improving health. We aim to help countries to provide health and nutrition services to everyone, especially the most vulnerable, through stronger and more resilient health system. We would try to support government to reduce future pandemic risk and ensuring global health security by investing in resilient health system, including emergency-ready primary healthcare, critical healthcare infrastructure, and the workforce, in order to help community to detect and respond to disease outbreak in a timely manner. We make the case that better health and nutrition outcome would lead to stronger human capital and a productive population. And as you can see here, we have 5 focus areas: service delivery, health financing, nutrition, climate and health, and pandemic preparedness and response. How we work as an institution. Actually, the World Bank Group consists of 5 different institutions under one umbrella. We have IBRD, with focus on lending to countries that have higher capital income, basically middle income country and above. We have IDA. This is the institution that focus on countries with basically low income countries. And we have IFC, investing in the private sector. We have MIGA, which act as an insurance agency to provide insurance against political risk and improve credit worthiness for low and middle income countries. And then we have the International Center for Settlement and Investment Dispute. This institution works as the arbitrator of investment dispute between government and the private sector. We have a range of instruments to achieve this objective, from knowledge and advisory to financing. We work at different levels, global, regional, and country level. And as a multi-sectoral financing institution, we work across sectors. So we are active not just in health, but when it comes to our health work, we want to make sure that other sectors that can contribute to good health, the health content also covered in those operations. I would like to talk a little bit about the way we work at country level. At the country level, given our relationship with Ministry of Finance, we we tend to be the agency that bring the dialogue between the facilitator dialogue between finance and Ministry of Health, and on the issue around domestic financing for health, as well as raising resources for health financing. Our funding are usually considered to be on budget rather than off budget. So hopefully our support would contribute to sustainable financing in the long run. Given the number of different situations within the bank, we act increasingly as one group to promote the health agenda. For health financing, dialogue with Ministry of Finance and government to increase government spending on health. We scale IBRD and IDA financing to fund health reform. On the private sector side, we have the IFC investment to enable leveraging private sector in health. We also co-financing with development partners, either through parallel financing or co-investment. We also have dedicated trust fund to support capacity development, analytical work, and knowledge sharing. And this is our current health portfolio globally. Our active portfolio in terms of investment is around 26 billion, over 150 projects in more than 90 countries. And in this particular part of the world, in Europe and Central Asia, our portfolio is 2.5 billion. I stop here for my colleague Mirja to talk more about our activities in Europe and Central Asia. Thank you.
Thank you very much. So first, I would also like to thank the government of Poland and the organizers for inviting us to this important meeting. My name is Mirja Sjöblom, and I'm leading the health and long-term care work that the World Bank has been supporting the government of Poland with for the past year. So it's a great pleasure to be here, and I will talk a little bit more about our work in Europe and Central Asia region. So as my colleague said, we have about 2.5 billion in Europe and Central Asia region in both technical assistance and projects, meaning financing. So it's a mix of work. Let's see if I can. Oops. Okay, here we go. So we recently have been looking at this region and see how we think that we can contribute best going forward. Both in terms of the global landscape and where we see our comparative strength, but also in terms of what's happening in the world. And I really like the reflections by previous speakers. So there are 5 areas that where we will focus our work in Europe and Central Asia region. The first one is related to healthy aging. So promote healthy living, improve coverage and quality of care, NCD care, but also redesigning of long-term care systems. The second area is around out-of-pocket expenditure, so the whole domestic financing agenda. And then also the third area is around strengthening preparedness for future pandemics and emergencies. The fourth area is around climate change and creating more resilient health systems. And the fifth area is around digitalization. So I will now go into each of these 5 areas and talk concretely about what we're doing and planning to do in Europe and Central Asia region. So looking at healthy aging, So here, as you see, ECHA has the highest aging rate globally. So there's really potential to do much more in this area. And it's also, we work, of course, globally, but I think ECHA region within the global institution is also leading on this agenda. And I want to give like a concrete example what we have been working on here in Poland. So last year we did actually technical assistance, what we call RAS, which is a very flexible an instrument where we can support technical assistance to government. And here we were funded by the European Commission, and we worked with the Polish government, bringing together stakeholders from all the institutions that are working on long-term care to do a strategic review of the long-term care system. And this one was published about a year ago. And since then, the recommendations of that strategic review were included as milestones in the Polish NRP roadmap, or the work that Poland is doing between EU and the Polish government. And a lot of the recommendations are now being implemented by the Polish government. We are doing similar work in Croatia, in Romania, and in Bulgaria. And we are actually scaling up in this area. And I'm leaving this conference tonight to attend our big LTC event that will happen in Vienna tomorrow, where we're bringing countries together from EU member states to exchange ideas and also discuss the pressing issues that they face in scaling up quality long-term care services. Second area, excuse me, is to reduce out-of-pocket expenditure. And as my colleague Nam mentioned, the entry point for the World Bank is often with the Ministry of Finance. So we really have an excellent opportunity to work with countries to discuss health budgets, to discuss, different ways of not just bringing in more money, domestic financing to the health sector, but also how you can pool funding efficiently and then use this money efficiently. And here we are supporting strategic purchasing function, how you purchase health services in quite a few countries. But we are also giving technical assistance to look at how you can reduce pharmaceutical spending, etc. So this is a key area of work. Third area is around strengthening preparedness for future pandemics. We do many different things in this area, technical assistance, but also investing in public health systems, such as lab, and upgrading primary healthcare systems so that they are better equipped to respond to the next pandemic. We also are doing quite a lot of work on One Health. And I want to highlight one recent initiative that was just improved by our board. This is in Central Asia, where we're doing $60 million US operation that is a regional operation on One Health. So we're working across 5 countries to help the regional coordination within these 5 countries, but also to support coordination structure within each countries, bringing together public, human health, animal health, and environment. And I think this is one of the strengths where we can not just work at the regional level, but also at the country level and across sectors, bringing in colleagues from different sectors. Fourth priority area, it's around climate resilient health systems. So in some of the countries that where we have financing projects, we are working with them to make their systems more ready for climate disasters. But I think one of the key contributions in this area is all the analytical work that we are doing. So we are doing this kind of country climate and development reports that look at how a whole country can adapt to the new climate realities. And often in these reports, we have a section on human capital where we look at the health sector. We also do climate risk profiles, and there are 12 of them already existing in ECHA region. And finally, on digitalization, this is an area that there's a huge demand from countries for support on digitalization. Oops. It's about creating interoperable digital health system, but also supporting with, some countries are still working with paper-based systems, so we need to help them to either create or upgrade their electronic health records. And finally, with AI, there's a lot of requests for support to think through how you integrate AI into your healthcare system and scaled programs, and also related to public-private partnerships in this area. So as you can see from sort of our internal thinking on our priority areas, there's a lot of similarities to the priority areas in the EU Global Health Strategy. So I just wanted to emphasize a couple of areas where we can see shared priorities around the aging agenda, around health system efficiency and sustainability, climate resilience in health system, pandemic preparedness, and health equity and social determinants. So we think that we can be a key partner. We are already, but we would love to work even closer with both member states and EU institutions on all these shared priorities that we have. And we also see new areas for potential collaboration. We could do much more together on primary healthcare, creating platforms of primary healthcare development, NCD prevention. I just attended a presentation last week when they were looking at development assistance for global health. And I think in 2019, the total assistance that went to NCD was just it was 1/10 of what was going, for instance, to HIV and AIDS. So I think this is also an area where we will see much more work, and our representative from WHO mentioned the conference in New York in September. So this is also an area where we are very keen to work with all of you. And then digital health, innovation, pharmaceutical supply chain. Agnes Sukat mentioned also the local manufacturing agenda and what a success that has been. And the World Bank is very much involved together with the IFC on that agenda. And in some countries, we are aligning very closely with the EU. And I think this is a really important opportunity where we can bring in financing, but also through IFC, bring in the private sector. And get the private sector perspective on the policies that the governments are developing. And then also bring in jointly with EU institutions, technical assistance programs that can really enhance the financing that becomes available. And then finally, on the health workforce development, this is also a key priority. My colleague Shona mentioned the jobs agenda. And if you look at one of the latest reports from our development committee, health is one of 5 priority sectors on the jobs agenda where we will work very intensely in the future. And the workforce, of course, there's going to be a lot of initiatives from the World Bank in this area, and there are many countries, the low-income countries, that are looking to that have labor surplus economies, that are looking if they can come and work in countries that really need workforce in the future. And I think there's a possibility there to work together to have managed migration programs. So those, and then finally protecting vulnerable populations and this is of course related to the whole financing agenda. So my last slide, actually, sorry, it's coming. So it's a little bit about how we can work together. So partnering on upstream alignment, as I mentioned, knowledge sharing and technical assistance and capacity building programs. There's also huge potential in co-financing and do parallel financing. We don't always have to put our financing in the same pool, but we can work and coordinate and then be more impactful together. And here also on the technical assistance that we are doing to countries such as more high income or higher middle income countries, such as Poland, we often collaborate with the EU institutions, and EU is funding many of those engagements through EU programs. So we are very excited to see the EU global health strategy and EU countries coming together in global health. And we are very much looking forward to partnering with you and working with you on this important agenda. And if you have any questions, we are available afterwards. So please come and chat with us.